In this disease, patient's bronchi are abnormally dilated. Always he is having copious sputum, productive cough. What is this common disease? It is bronchiectasis. Write down the definition of bronchiectasis. Bronchiectasis is abnormal dilatation of bronchi, abnormal dilatation of bronchi due to loss of muscle and elastic tissue, due to loss of muscle and elastic tissue. This muscle and elastic tissue are the structures maintaining the architecture of your bronchus. Your bronchus is firm because of this muscle and elastic tissue. Whenever they are damaged, your bronchus can become lax and dilated. This phenomena is called as bronchiectasis. Let us see what is the mechanism of bronchiectasis. What is the mechanism of bronchiectasis? There will be an initiating event. What are these initiating events? We will discuss in etiology. Because of this initiating event, there will be altered clearance of mucus and secretions. Because of this initiating event, mucus and secretions is not getting cleared from your lung. This results in stasis of secretion, stasis and obstruction. Whenever secretions are static and there is an obstruction, there will be infection. Infection will result in some inflammation. Because of this infective and inflammatory damage, there will be destruction of muscle and elastic tissue. Because of that destruction, there will be dilatation of airways. Now tell me, students, this destroyed and dilated airways, will it have good mucociliary clearance or bad mucociliary clearance? It will have bad mucociliary clearance, and this cycle will continue. This is called as the famous vicious cycle theory of bronchiectasis. So bronchiectasis is a sequence of continuous events. What are they? Stasis, obstruction, infection, inflammation, destruction, dilatation. Because of this, at any point of time, if you see the airway, it will be abnormally dilated. It will be filled always with some secretions. It will be filled with secretions. So whenever air is flowing in these secretions, you will get a bubbling sound called as coarse crepitations. Most common presentation of this patient will be cough, that too productive cough. Most common presentation will be productive cough. Along with that, coarse crepitations on auscultation. Most common presentation will be productive cough, along with that coarse crepitations on auscultation. Now what are the initiating events that can be responsible for bronchiectasis? Let us see etiology of bronchiectasis. Etiology of bronchiectasis. The first group of events, it can be due to bronchial obstruction. Bronchial obstruction. This bronchial obstruction, either it can be intramural bronchial obstruction or extramural bronchial obstruction. If you consider this is the lung, let this be the bronchi. Intramural bronchial obstruction means there is an obstruction within the bronchus, within the lumen of the bronchus. Because of this obstruction, distally there will be stasis of secretions, ultimately bronchiectasis. Examples will be endoluminal tumors, tumors that will readily arise within the bronchial lumen. It can be due to squamous cell carcinoma, small cell carcinoma, carcinoid. Extramural means the obstruction is not within the bronchus. Something outside the bronchus is compressing the bronchus. So, because of that there will be bronchus getting compressed and ultimately there will be bronchiectasis. The best example is TB lymph node. Extramural enlarged lymph node can compress bronchus, In the same way, excessively enlarged TB lymph node can compress, right middle lobe bronchus, resulting in right middle lobe collapse and bronchiectasis. This combination of right middle lobe collapse and bronchiectasis, it is called as Brock's syndrome. Now, why will TB lymph node specifically compress right middle lobe bronchus? Where does TB lymph node enlargement happen? Hilum. At the hilum, what do you have? Right middle lobe. Because of compression of right middle lobe, there will be right middle lobe collapse and bronchiectasis. Now, what is this entity called as? Brock's syndrome. This is the first group. Second group, it can be due to bronchial injury. This bronchial injury can happen either because of direct infection to the bronchus or as a part of connective tissue disorders. These connective tissue disorders such as rheumatoid arthritis, SLE, scleroderma, they directly as a part of systemic involvement involve the bronchus, damage the bronchus, resulting in bronchiectasis. Infections, TB right now is considered as most common infective cause for bronchiectasis. So, if they ask you what is most common infective cause of bronchiectasis, your answer should be tuberculosis. Along with that, adenoviral infections, other bacterial infections can also cause bronchiectasis, but TB is considered as most common infective cause. Then this can occur as, traction bronchiectasis in interstitial lung disease. The mechanism of traction bronchiectasis is completely different. Let us discuss here. It has nothing to do with vicious cycle. Let this be one bronchus. This is one airway. This is another airway. In between the airway, there is interstitium. Let this be the interstitium. Now, in interstitial lung disease, there will be fibrosis. Where this fibrosis predominantly happen? Interstitium. Now, because of interstitial fibrosis, what is going to happen? Fibrosis, is it expanding process or shrinking process? It is a shrinking process. So, the interstitium will shrink. Because of shrinking of interstitium, what will happen? The lateral limbs of the airway will be there itself, but the medial limbs will be pulled together. The medial limbs will be pulled together. Why they are pulled together? Because the tissue in between them has underwent shrinkage. Now if you notice, initially this was the diameter. Now what happens? The diameter of airway has increased. Any abnormal increase is called as bronchiectasis. Why it is happening? Pull of medial ends together. So it is called as traction bronchiectasis. Try to understand this simple mechanism. Initially there were two airways like this. Okay, in between them there was interstitium. Now because of interstitial fibrosis, the medial ends are pulled together. The medial ends are pulled together. Because of that, what has happened to the diameter of airway? It has increased. So this is bronchiectasis. Why it has happened? Because of pull of medial ends together. This phenomena is called as traction. So it is called as traction bronchiectasis. Next we have genetic causes. Genetic causes such as ciliary dyskinesia, ciliary dyskinesia, cystic fibrosis, cartilage defects of airway. Genetically, the cartilage of airway is not developed. Again, the airway can dilate. Cartilage defects of airway, such as William Campbell syndrome, such as William Campbell syndrome. Along with that, the famous yellow nail syndrome, the famous yellow nail syndrome. Yellow nail syndrome is characterized by a triad. What are the three important features? There will be congenital lymphedema. There is congenital lymphedema. There will be yellow nails. There will be yellow nails. There will be pleural effusion. There will be pleural effusion. Along with this, there can be bronchiectasis. But bronchiectasis is not included in the classical triad. Classical triad of yellow nail syndrome is congenital lymphedema, yellow nails, pleural effusion. Bronchiectasis is an additional feature. Whenever you don't know what exactly is the reason, what is that group called as? Idiopathic group. Idiopathic group. As of now, idiopathic group is the most common group of bronchiectasis. Still in majority, we don't know the exact cause of bronchiectasis. This is the etiology of bronchiectasis. Bronchial obstruction, bronchial injury, traction bronchiectasis, genetic causes, idiopathic group. Let us see the site of bronchiectasis. This is based on observation from multiple studies. No specific mechanism involved. They will ask you in your exam, what are the causes of upper zone bronchiectasis, mid zone bronchiectasis, lower zone bronchiectasis. Write down site of bronchiectasis. Site of bronchiectasis. Let us say this is the lung. They are going to ask what are the causes of upper zone bronchiectasis, mid zone bronchiectasis and lower zone bronchiectasis. Upper zone bronchiectasis is frequently seen with cystic fibrosis, tuberculosis, post-radiation bronchiectasis, after radiation also there can be damage to the bronchi that can result in bronchiectasis. Mid-zone seen with ciliary dyskinesia, ciliary dyskinesia syndromes, infection with Mycobacterium avium. What is Mycobacterium avium? It is atypical mycobacteria. Then lower zone bronchiectasis, interstitial lung disease, chronic aspiration, and majority of idiopathic bronchiectasis. Majority of idiopathic bronchiectasis. This is site of bronchiectasis based on observation from many studies. Then coming to general treatment of bronchiectasis. When a patient with bronchiectasis reaches your hospital, how will you treat? The main problem with the patient with bronchiectasis is he will be having thick sputum, very difficult to expectorate. To counter this, I give him airway clearance. In airway clearance, I prescribe him mucolytics. Along with that chest physiotherapy. Now what is the benefit of mucolytic? It is going to make thick secretions thin. Then what is this physiotherapy? I am going to gently tap on the bronchiectatic areas. So when I tap like this, there will be some vibrations. Because of that vibrations, patient can develop cough reflex. Already I have made thick secretions thin. Now if there is development of cough reflex, it will facilitate expulsion of that secretions. Second important thing, these patients are frequently having infections. To counter that infections, definitely antibiotics. During exacerbation, during worsening, I have to give antibiotics. But once the patient recovers from exacerbation, he can again develop infections. That's why I should also give antibiotics as prophylaxis. Why as prophylaxis? To decrease frequency of infective exacerbations. Now what are the antibiotics available as prophylaxis? The first group will be inhaled form. We have either inhaled colistin, gentamicin, tobramycin. Colistin, gentamicin, tobramycin. If it is not available, we can go for azithromycin. In few areas, they admit the patient once in every month and they are giving antibiotics, IV antibiotics, intermittent IV antibiotics. In Western countries, they also prescribe oral fluoroquinolones. But in India, because of high TB burden, we are not giving fluoroquinolones. These are the various prophylaxis options. Inhaled colistin, gentamicin, tobramycin, oral azithromycin, intermittent IV antibiotics, fluoroquinolones. Then, if the patient develops hypoxemia, you should prescribe him oxygen therapy. If there is localized disease, suppose there is right lower lobe or left lower lobe bronchiectasis, it is already destroyed lung, it is not taking part in gaseous exchange, you can go for resection of affected part. If there is a more diffuse disease, the option will be a lung transplant. the option will be lung transplant. These are the treatment options, students. So, airway clearance to bring the secretions out, antibiotics definitely during exacerbations, and as prophylaxis to decrease frequency of exacerbation. If hypoxemia, oxygen. If localized disease, resection. If there is a more diffuse disease, I am going to go for a lung transplant. This will be the general management of bronchiectasis. Let us see a case scenario. This patient has come to you with chronic productive cough and coarse crepitations. When you see these two in combination, your suspicion should be bronchiectasis. They have given a CT and asked you the diagnosis. Now, in this CT, if you notice, can you see dilated airways? Dilated airways similar to parallel railway tracks? Yes. This finding is called as a tram track appearance. Presence of tram track appearance on CT chest, it is suggestive of bronchiectasis. See here, dilated airways looking like parallel railway tracks. This is called as tram track appearance. So, can you see this students? So, these are the dilated airways. So, you can see the airway is dilated. So, this is similar to parallel railway tracks. So, it is called as tram track appearance. It is called as tram track appearance because this finding can be seen easily on a CT chest. Investigation of choice for bronchiectasis is a CT chest. So, the finding is tram track appearance, the disease is bronchiectasis. Investigation of choice for bronchiectasis is generally CT chest. So, this is regarding bronchiectasis. In your exam, they can ask you regarding the site of bronchiectasis, they can give you a clinical scenario, they can give you a CT scan, they can ask you what might be the diagnosis.